I understand we had a few parking issues today, so I waited a few minutes. But now that the important people are in the room, we can get started, right? So I appreciate your making your way in these heavy snowstorms. I hear we haven't seen anything yet, right? That we have a little bit of snow headed our way from people who are coming from the west side of the state. They say it followed me, so it should be here soon. I don't know. I haven't listened to the weather reports, but I'm going to invite the panelists to come up and take a seat, and we'll get going. We have a really full program today because we have so much expertise on our topic. Urban meets rural, balancing human and environmental health. So I'm sure that I guarantee you will learn quite a bit today. And some of the things that you'll learn about, you've heard about, but you may not know the real skinny on these things, and that is the incidence of Lyme disease, rabies. More recently, you've heard quite a bit about Eastern equine encephalitis, or 3E. We're going to talk about those things in the box of wildlife management strategies and options for keeping both animals and humans healthy as they continue to interact. And so, again, I think you'll gain quite a bit of knowledge from today's program. First, to speak to you is Melinda Wilkins. Dr. Wilkins is on the end here. She's an associate professor for One Health, Public Health, and Global Health Education. She's also the interim chair for the Large Animal Clinical Sciences at Michigan State University. And her area that she pays attention to most is disease surveillance, surveillance systems, and zoonotic disease, epidemiology, and outbreak investigation. So she spent quite a bit of time in the Department of Public Health as well, so she can definitely relate to what's happening in the community. I'm going to keep these introductions rather brief. You have their full bio sitting there at your table, so you can refer to those, and I see that some of you already have studied your notes. Following Dr. Wilkins is Dr. Malawan, Rebecca Malawan. She's the Director of Research for the Institute for Global Health in the College of Osteopathic Medicine at Michigan State University. She graduated from University of Michigan before going to the U.S. Peace Corps, and she spent some time in Niger in West Africa. She went to Johns Hopkins Bloomberg School of Public Health and studied epidemiology. It's a pleasure to have you, and I know that your international experience will really lend to today's discussion as well. We also had Nike Shoyinka, who is a rather new medical director at the Ingham County Health Department, but certainly not to public health and community and rural setting. She attended school in Nigeria before coming to the U.S. and working at the Harlem Hospital Center in New York. She moved to Detroit for a fellowship at Detroit's Henry Ford Hospital, and just decided to stay with us right here in Michigan. She is board certified in the American Board of Internal Medicine and Infectious Disease and Internal Medicine. And she's, as I mentioned, is currently serving as the medical director at the Ingham County Health Department. Chad Stewart will follow Dr. Shoyinka. And Chad is the deer, elk, and moose management specialist and a certified wildlife biologist for the Michigan Department of Natural Resources. A real popular guy at this time of year, right? As deer hunting is upon us. So Chad's work has mainly been in wildlife sciences and natural resources, and he graduated from Penn State. So we've got some really strong Big Ten universities here. University of Illinois is another one that he sought some experience from, and also spent time working for the Indiana Department of Natural Resources. So again, you have the international experience on wildlife projects in China and Malaysia. So we welcome you to our panel today, Chad. We have Kelly Straka. Dr. Straka is the state wildlife veterinarian and wildlife health section supervisor for the Michigan Department of Natural Resources. Her expertise or her main interest is in the ecology of infectious agents and the interfaces between wildlife, livestock, domestic animals, and public health. So most of her work has been, or started out in fisheries and wildlife management, and you refine that a little bit and by going into veterinary public health, and received her doctorate of veterinary medicine from the University of Minnesota. So we have just an amazing panel today, very well informed. I'm anxious to get them up here, so let's begin. We're going to hold the questions until the very end, and we'll bring a mic around to you when we have our discussion. Thank you.
Yes, sir. I'm going to time myself so I don't go on and on as we want to do. So thanks for being here today. This is a really nice opportunity. I'm going to actually talk about One Health, which is a concept that you sort of know intrinsically, but you might not have heard the term. Has anyone heard the term One Health? All right. So I can click and go. So what is One Health? This is a definition from the World Health Organization regarding One Health, and it's an approach to designing, implementing programs, policies, legislation, and research in which multiple sectors work together to advance better public health outcomes. So this definition came from World Health Organization, and so it's kind of human-oriented. It's looking at health and how it benefits humans. The Centers for Disease Control also explains One Health as a fact that as an agency, CDC recognizes that the health of people is connected to the health of animals and the environment. And it requires collaborative, multi-sectoral, and transdisciplinary approach. And also working at the local level, the regional level, and the federal level, and even globally, to deal with some of our biggest health issues. And this is a long slide, I won't read through it, but One Health Initiative is also considered a movement to try to shift the way we think about some of our more difficult problems, especially in the health realm. And I just wanted you to know that, look at all of the different associations that are really on board with the One Health concept. And besides these, in the U.S., there's also WHO is now on board with One Health, the Food and Ag Organization, and the World Health for Animal Health, World Animal Health Organization. So it's actually a pretty global movement. So why do we need a One Health approach? The fact is that a lot of the microbes out in the pathogens, bad diseases in the environment, they don't really respect borders very well. They'll take any host that they can get. So there's actually a lot of movement of diseases between animals and people and back again. And about 75% of new or emerging human infections are actually coming from animal populations. So this is fairly relevant when we're talking about the issues around, the intersection of humans and the environment that most of these discussions are going to be on today. And when some of these diseases move from animal populations to human populations, they can have very devastating effects. And this is just a term. I said that 75% of the pathogens are zoonotic in nature. That basically means that there's zoonotic disease that can transmit between animals and people. And actually, they can go from people to animals as well. So it's an easy flow for pathogens, easy to jump the species barriers. Some pathogens do it more easily than others, and we're going to talk about some examples of those today. And there are a lot of other factors that affect human and animal health both, and basically, human population is growing. If you haven't checked, it's actually growing at a fairly terrifying rate, the whole globe. And we're expanding constantly into new geographic areas. So when that happens, more and more people are living in closer proximity to animals, to wildlife, and we sort of are inserting ourselves into a disease transmission pathway that, that maybe it was between deer and mice, and now we live there, and so we pick up the ticks that, and we can get that disease. So the closer we live in proximity, the more likely it is we're going to insert ourselves into existing disease cycles. And we've experienced quite a bit of climate change and land use, deforestation, and intensive farming practices. So these are all types of issues that can really disrupt the environmental conditions that are, already under stress. And again, when we change habitats, animals move, the vectors, the insects, the ticks, they move also. So it just causes a lot of disruption, and again, more opportunities for those diseases to pass from humans to animals and back again. And now international travel and trade have really increased, and so we've had a few examples of that where it's actually not difficult for what would be considered an exotic disease. An infected person or infected animal can now fly across the globe in about 15 hours and come into a whole new population of susceptible people or animals. So these are just a few of the drivers. There's like tons of papers on what is driving these emergence of infectious diseases, but these are kind of a couple that kind of fit in with today's discussion. So this is kind of a Venn diagram. It's the kind of the traditional One Health Venn diagram. So what this basically shows is that we have animals, we have people, and we have the environment. And they're not separate circles. There's a lot of overlap between these three populations. Where there's the most overlap is in the middle, and that's kind of where One Health practitioners work. So it's sort of understanding that all of these issues are very closely interconnected. And you can see some of the traditional sciences or professions, disciplines like veterinary medicine, biology and animals. We've got the earth sciences or ecology and human medicine. And then you can see where there's some of the sciences that already are, specialties in those intersection areas. This is another Venn diagram that I actually like a little better. As a veterinarian, I like to separate out the animal circles into domestic animals and wildlife. So this one shows humans, domestic animals, wildlife, and then the bigger circle is the environment. So I prefer this Venn diagram myself. There's a lot of different versions of it. But I think there are a lot of different issues when you deal with wildlife versus domestic animals. So One Health itself isn't a new concept, but it kind of became a popular term to use in the early 2000s. That's my 4-minute warning, I think. But this resurgence was really driven by the avian and swine flu epidemics, where it became really obvious how quickly diseases could move, how they can reassort, they can move from wild bird populations into domestic poultry and swine, and then into humans. So that kind of brought this whole One Health issue to prominence. It's difficult to argue with the common sense logic of all these professions working together, but it's difficult to realize the true potential of a One Health approach as well. I'm sure that you could probably think of some of the complications with territorialism, funding, grant funding, research. We all tend to work in our little silos, and it takes considerable effort to actually reach outside of your silo and work together more collaboratively. So let's see if we can make it real in about 3 minutes. I think you all probably have heard of rabies. So I wanted to just talk a little bit about rabies. This is the diagram I just showed you, my preferred one, with the environment on the outside. In Michigan, where does rabies hang out? Like where's the reservoir for rabies virus in Michigan? Of these 3 circles, what's your guess? Wildlife, excellent. You get stars. So in Michigan, our natural reservoir for rabies is actually in bats. And we also do get some positive skunks as well. So what other animals can get rabies? Raccoons? Do we have raccoon rabies in Michigan? No. Knock on wood. Not yet. Domestic animals. Just about all domestic animals are susceptible to rabies, except rodents and rabbits, I think, are not very susceptible. But pretty much other warm-blooded animals are susceptible. So you can see that we've got a lot of overlap already. What about people? People get rabies? Yes, sadly. The last rabies death in Michigan was 2009. It was a gentleman that had a bat on his arm, and he didn't realize the implications. He just knocked it off, and about 9 months later, he had severe symptoms and he died. So in terms of the intersection, what I want to kind of point out is there are a lot of agencies involved in dealing with something like rabies. It sounds like it's pretty straightforward, but in reality, we have agencies that deal with the human health side. We have physicians. We have different issues with insurance On the wildlife side, we have DNR, we have wildlife rehabbers, we have enthusiasts, animal control officers, educators somebody needs to tell kids not to pick up bats, right? I mean, we love bat houses in the high up areas, but don't pick up bats. And then on the animal side, we have the animal owners, local health departments, licensing agencies, which is managed at a county level, and veterinarians and so on. And then the environment, you need to think about what is bringing everyone together. In what situation is your dog going to be encountering a skunk? Or your cat's going to go find the bat that's acting weird? Or you're going to be out in the woods and you say, oh, there's this cute little skunk wandering around and you look really dizzy and confused. Don't pick it up, please. So, what we need to think about is not just physical environment that can bring all these things together, but also regulatory issues. Rabies in Michigan, we have it well under control because we educate and we regulate. But across the globe, there are about 59,000 deaths due to rabies. And so this is not an issue to take lightly. And the reason we don't have a lot of rabies in Michigan is because we have licensing and we have rabies vaccination laws, and we do a lot of education around it. So that's my little soapbox. I'll move on. And I want to give a shout out because Michigan's been actually doing a lot of work with a multidisciplinary rabies working group for years. And I also wanted to show the Michigan Emerging Diseases Issues website. And I don't know if, Leah, can you click on that? It's a live link. I thought I'd have a computer in front of me. But this is a website where you can get a lot of information about a lot of the diseases you're going to hear about today. There's tons of data, information. You can go on there and search by county. You can search by disease. You can find out how many cases there have been. I think 53 positive rabies cases in Michigan. Not going? Okay. And 43 of those have been found in bats and 10 of them in skunks. And that's to date for 2019. You can go right on that website, do your little search, and find out all that information. Tremendous amount of information that would be relevant to you as you're getting questions from your constituents. And I just wanted to leave you with some resources. That's the Michigan Emerging Disease Issues website. There's surveillance data, and some of these others, as well as CDC has great information as well. Thanks.
I'm going to talk about something that's near and dear to my heart because I actually completed my dissertation on Lyme disease back in 2001. So you may need to give me the hook because I could talk well more than 10 minutes for this. So I'll be talking about Lyme disease, which is both a global and local One Health challenge. Whoops. So as Dr. Wilkins suggested, Lyme disease is a great example of One Health. We have the environment with warming temperatures globally. There's been an expansion in tick habitats to new areas, including Michigan. Humans have been moving outwards towards the suburbs and buying larger tracts of land that maybe are up against wooded areas, which is bringing us into contact with ticks and other animals. Also reforestation, which is as humans have caused in some instances, is resulting in this. And then as a result of the reforestation, there's been an explosion in mice populations due to a loss of predators. And then also pets can carry ticks into the house, so they're also a vector for us in getting Lyme disease, which has resulted in many parts of the United States in what's been termed Lyme anxiety. This is actually a movie about ticks that came out many years ago. And so I'm going to talk to you about how we can alleviate some of that anxiety. In some areas like Connecticut and Maryland, where I did my dissertation, there was a lot of concern about Lyme disease. So the objectives of this brief presentation are to describe the clinical presentation, epidemiology, and transmission of Lyme disease, present some options for both personal and community prevention of Lyme disease, and provide some links to some helpful resources for you. So what is Lyme disease? It's actually the most common vector-borne disease in the United States. It's caused by a bacterium, originally just thought to be Borrelia burgdorferi, named after Willy Burgdorfer, but there's actually many other Borrelia out there that do cause Lyme disease, and Borrelia mayoni has been found to cause it in the Midwest as well. The disease is named after Lyme, Connecticut. In 1970s, there was an epidemic in children living in Lyme, Connecticut, and that's where the disease name came from. However, the disease has been recognized since the 1800s in Europe. So even though it's kind of new to the United States, it has been in existence for several hundred years. The bacterium is transmitted by hard-bodied ticks. Here in the east or the Midwest and the east, it's the deer tick. There's another western black-legged tick in the west, and then other ticks in Europe. So what does it look like? What is the clinical presentation? You probably have heard of the bullseye rash. That's usually clinically the most common representation of Lyme disease, and it's also often accompanied by flu-like symptoms, fever and chills. If it's not caught early, it later moves on, and you can get facial palsy, which is sort of a drooping of your face, arthritis, dizziness and shortness of breath, and it can actually move into your heart, and you can get what's called Lyme carditis. These are sort of the clinical presentations that you might see in practice. Generally, it's easily treatable with an antibiotic, a common antibiotic. There are a few cases that are what are called chronic Lyme disease or post-treatment Lyme disease, where people continue to suffer after the initial antibiotic, but it's rarer. Most people do resolve. Globally, you can see that Lyme disease is actually spread throughout the world. There are cases all over the place. And in the United States, it's increasing in prevalence. So in 2001, you can kind of see where it was distributed in the United States. And by 2017, you could see that it's firmly across the East Coast, it's in the Midwest, and it's coming into Michigan. And in Michigan, these are where we find it in Michigan. So in the US last year, there was about 30,000 reported cases of Lyme disease, and in Michigan, about 300. So and it's becoming more common in Michigan. So these are cases that actually people were bitten by a tick in Michigan. So in Michigan, these are the ticks that are most frequently found. In Michigan, if you are bitten by a tick, you actually can send the tick in to be tested to see what kind of tick it is and to see if it's infected. So of the ticks that have been submitted in Michigan, the majority of them are the American dog tick, which does not carry Lyme disease. They can carry Rocky Mountain spotted fever and tularemia, but it's pretty rare in Michigan. Only about 15% of the ticks that were sent in were actually the black-legged tick, which is the two ticks on the far left. So those are the two stages of the tick, a nymphal tick and then adult tick. And you can see here, this is how big those ticks are. The nymphal tick is very small. And this here, too, is the life cycle of a tick. A tick generally lives about 2 years. In the spring, when they are eggs, they turn into larvae and start looking for to feed. And they generally feed on rodents and sometimes birds. Thank you. At that point, after they take a blood meal, they'll actually overwinter again, and when they become nymphs, and they'll often then feed on either rodents or larger vertebrate animals like deer or humans even at that point. Then they turn into adults at that point, and they'll take another feeding. Now, what's interesting, there are a lot of things you can do to prevent tick bites. So this was part of my dissertation. We actually did a randomized clinical trial of behavioral interventions to prevent tick bites in the Baltimore County region of Maryland. So the most common things to do are to protect yourself using repellents. The most common repellents used are DEET, at 20% or permethrin. DEET is applied to your body. Permethrin is applied to clothing. So if you're a hunter, that might be a really good option for you to spray your clothes with permethrin before you go out. Another thing that you can do is to detect ticks. So do a tick check after you think that you've been in an area where you may have experienced exposure. Oftentimes this is good to do in a shower. Ticks like to climb upward. So if you find them early enough, you probably want to look lower, but they do like to climb upward and can get into your hair. The nice thing is if you detect and remove a tick within 24 hours, your risk of infection with Lyme disease is greatly reduced because it takes about 24 to 48 hours to actually transmit the bacterium into your body. Another interesting thing about ticks, though, is that when they bite you, you won't feel it because unlike a mosquito, they actually inject an anesthetic into you so that you cannot feel the bite. That's why it's very important to actually look for them. And then to remove it, there's a lot of sort of old wives' tales out there about how to remove, but you want to use a tweezer because you want to make sure that you remove the head because it can still continue to transmit infection into you, and you can get just another infection by having the head still in there. So a tweezer is the best way to remove. Burning it or trying to suffocate it with Vaseline does not work, which are things people try. Another thing you can do, depending on where you live, is sort of residential management of ticks. So I will leave this up here, but you do want to create some space between you and maybe if you live near trees and wilderness, or you want to make sure that there isn't leaf litter near your house. You also want to make sure that you don't have firewood near your house because those are places where ticks and rodents like to live. There are also things we can do in our community to prevent Lyme disease. We can make sure that there's signage in known areas of Lyme disease risk, such as parks, and also inform people what they should do to protect themselves. Don't just say, hey, there's Lyme disease here, because that can create Lyme anxiety, but just saying, hey, now that you're in this area, you might want to make sure you wear repellent or wear protective clothing. It's also good to have community education efforts like public service announcements as it becomes more prevalent in Michigan. And then also some advocate for environmental spraying of high-risk areas. So if you know that there's a lot of, if there's a school that is close to a forest and there's a lot of children playing there and you know that it's a high-risk area, it might be worth spraying. There are a lot of helpful resources out there. The state has quite a few resources that are fantastic. The CDC does as well, both for the public and for clinicians. So most of the material that I have presented have come from those resources. And then I just want to take 1 minute and talk about a new program that we've created here at Michigan State University. We're actually launching an online Master's of Science in Global Health in January of this year. We are going through the curriculum committee to modify it so that it can be completed in 1 year. It's entirely online, and the focus of it is really trying to encourage experts from different technical areas to work together on sort of One Health topics and One Health issues. So we're very excited about this. We have a lot of interest both domestically by students in Michigan and then also globally with our partners all over the world. So we have students coming from Dominican Republic, Mexico, all over. So that's a pretty exciting initiative that we're just beginning. And here's some more information about that if you'd like to know more. So thank you so much. Yep.
So I've been tasked with talking about Eastern equine encephalitis as a good example of how we should pay more attention to One Health. Can you hear me? Okay. As a good example as to why we should pay attention to the whole concept of One Health, as Dr. Wilkins had explained. If you haven't heard about, let's see what this clicker's doing. If you haven't heard anything about Eastern equine encephalitis, well, over the last couple of months, here are a couple of clips that I just put in there, but I'm sure everybody over here has seen something about it, heard something, had a conversation about it, and so obviously it's something that, even though very rare, has really touched us here in Michigan. First of all, I'm going to talk a little bit about the virus itself, the Eastern equine virus itself, a little bit of history. It's been around apparently for a really long time. It was first identified or described in 1831, but then the first time that the virus itself was isolated was like 100 years later in 1933 from a horse. And then there were outbreaks. There was a first noticeable outbreak in 1938, and that was when it was first noted in humans. And since then, there have been sporadic outbreaks, throughout the country, but particularly in, the eastern border, all the way through kind of like the Gulf. The biggest outbreak so far, human, was in New Jersey in 1959. And then since then, up until like 2010, we would say that the human number of cases has been about 300 in total. Here's a little bit about the virus itself. It's an arbovirus. So when we say arbovirus, we mean it's a virus that is from an arthropod, carried by an arthropod, so arbor-borne. It's carried, the arthropod that it carries is the mosquito, and it belongs to the family of the alpha virus. I won't bore you with the details of that, but we had talked about how Lyme disease was the most common vector-borne disease. In the United States or in North America, it seems like the Eastern equine encephalitis virus is probably the most virulent. It causes the most severe of encephalitis, brain inflammation diseases or infections, so to speak. And there are two variants of it, but the one that we see in the North America seems to be the more virulent one. This is what it looks like as a clinical disease. So one, you could get infected and not know you had the infection at all and be totally asymptomatic. Or you could have a systemic disease where you would just feel like you had the flu. You'd have a fever, headache, body aches. It will look like a flu. You're probably not going to do anything about it in terms of, seeing a doctor, or even if you do, you're probably not going to be tested to be diagnosed with the infection itself. And then we have the neuroinvasive disease, which is the one that we're particularly, concerned about, which is what has really, gotten our attention over the last couple of months. It's said that about a little less than 5% of people who have this infection will have the invasive disease. And that's where you have a very high fever, headaches, and then things rapidly progress where there's altered mental status and confusion, seizures, and then people who have this neuroinvasive disease, about 50% of them or more, will have permanent neurological damage. And then, of course, as I'm sure you've heard, the mortality is pretty significant. At least 1 in 3 people will die of the infection. It does confer long life immunity overall. So if you do get the infection, then you're less likely to get it ever again. So one of the important things about the virus is it needs a vector to carry it, right? And the main vector that carries this virus is a mosquito called Culicera melanura. And if I pronounce it wrong, Kelly, let me know. And this particular mosquito loves birds. So it's a bird biter predominantly. And so it creates this little life cycle where, mosquito bites bird, then another mosquito bites that bird that is infected, and then, it just creates this cycle. And the bird in between becomes like an amplifying host. But then we wonder, how do humans and, horses get it, which is what we've all heard about, right? And so that's where the virus itself needs a bridge vector. And that's a different species of mosquitoes. And the most common one is the I keep having trouble saying this, Coquilitidia species. There are a few other ones there, but that's the main one. And what happens in here, and I'll show you in the next slide, is if you take a look at this, you'll see that we have the mosquito, the original mosquito that bites the bird, right? That bites the reservoir host. And that kind of goes in, a continuous cycle. Somewhere in there, we have this new species of mosquito that also bites on the bird, but will also bite on humans and horses and other mammals generally. And that's our bridge vector. The bridge vector is what will then confer infection to mammals in general. Mammals overall are dead-end hosts or incidental hosts, meaning that once they're infected, they don't pass it on to anybody else. So horses won't give it to another horse, a horse won't give it to a human being. And the only reason is because when they're infected, even though it causes such severe disease, they don't have enough virus in their system, which kind of seems unfair, considering the fact that the bird gets so much viremia and doesn't get sick at all. But just looking at the way things happen, I did want to mention that, where we see the mosquito most of all is, of course, in swampy areas, just like what we see in the Great Lakes, and of course, eastern seaboard. They like swamp forests where you have like hardwood, and so we see that's where those things have happened over time. We also see, based on this surveillance study, that it happens just like what we've seen here in Michigan around the summer months. Overall, where the highest incidence was about in August, September, and as things cool down, hopefully, we don't see as much infection anymore. But overall, that's the sequence of things, but it's hard to tell when we'll have these outbreaks. For example, and I'll show another slide soon after, it's hard to tell when these outbreaks will occur because there's so many things going on at the same time. And that's where the whole One Health concept comes in. Things change rapidly, weather changes, temperature changes, how much did it rain this year, how much human activity, we talked about what our built environment looks like. Do you live close to forests, to where there's a lot of wildlife, or are we moving closer to those places, and what does that do to vector and host spread overall? Bird migration, how many birds are moving over, are traveling from one end to another during each season. All those things determine what things look like. Sometimes if we take a look at the way things look overall, it does seem like there might be like a 10-year cycle in terms of where we see outbreaks, but it's not very clear, and it's definitely not clear cut. This is a slide just showing what the incidence of triple E has looked like over like a 13-year period. The gray part is where we have non-human infections, and then the black dots are the human infections. And you can see there's a little overlay, but definitely there's more of non-human infections going on in there. Here, I just wanted to show what this current outbreak looks like nationally. So over the last 10 years, 10 years, there were 72 cases overall. But then in 2019 alone in the United States, we've had 35 cases, 10 of which were in Michigan. So of course, like I said, there's no good way to indicate why we've had this year, but that's what things look like for now. This is what Michigan looks like in terms of our human versus our animal cases. And we can see most of it is in Southwest Michigan overall. This is so when we talked about the Michigan, the MDHHS website. If you go there and you check that link there, the michigan.gov/EE, you'll get a lot of information as to what is going on, what the numbers look like, and this is the most recent updated number. That number 21 of human cases is not just triple E, but also other arbovirus infections. But with regards to the number of counties that were affected, that have reported AAA, 17, and then 46 animals in total, which included, horses, deer, a wolf pup, sheep. So yeah, different animals overall. So what exactly is the public health response to AAA overall? There are a number of things that can be done. First of all, you have the conversation with the public overall about source reduction. Communication is pretty important with regards to managing these kind of outbreaks overall. And when I talk about this, I will be referring to triple E, but you can extend this to any condition, essentially. So first of all, I wanted to talk about communication. It's important as public health agencies for us to give timely collect information and disseminate information about the disease. So for example, with AAA, it was important for us to have the info, as soon as things were reported, there was media releases and information to the community and to providers, healthcare providers, making sure that they know how to report, they have a higher suspicion of the disease, they know where to go and how to order testing, they know how to report it so that we can get proper surveillance and epidemiology information in a timely fashion, so that way we can figure out how to reduce and prevent these conditions. These are just a couple of examples. For example, one of the ways that we do that with regards to healthcare providers is the MyHAN, which is the Michigan Health Alert Network, which is something that every physician in the state should be signed up on. So if you do want to talk to your physician and ask them if they're signed up on MyHAN, that will be helpful. That way they get to know exactly what is going on, if there's anything suspicious going on within the state, within their environment, and it definitely helps. Oops. So, triple E, in addition to so many other diseases, are notifiable diseases, meaning that they can, when they do occur by state, according to the Public Health Code, they need to be reported to the health department or to the state. And so there are different ways to do that. One of them is through MDSS, which is the Michigan Disease Surveillance System, or otherwise providers just call their local health department, and then we as a health department, we take it from there. There are other surveillance is a big part of that, and that communication kind of trickles into the concept of surveillance also. And I already mentioned the Michigan Disease Surveillance System. This kind of shows what is being done at a level with regards to surveillance for vector-borne diseases, and I just wanted to show this to show how every single level of the health system, of the public health system, is intricately connected. So from the local and state partners to academic centers to wildlife, DNR, and then moving on to the states where they have a specific emerging and zoonotic infectious disease section, and then they move on to report things to the CDC, and that's where decisions are made about and recommendations and guidelines to further guide us. The last thing I wanted to talk about is the mosquito surveillance really quickly. Within the state of Michigan, that's one of the things that has that was important or is important with regards to the current triple E outbreak. A lot of it is done in cities and townships and not as a state program. So some places like Saginaw and Bay City do have some programs such that work with mosquito programs that work with the local health department and with the state. Some of them are funded individually, and some of them are funded by the CDC. Other things that we talk about, of course, are the public health things that we communicate to people, eliminate your breeding grounds, and of course, protect yourself. The other really interesting thing that happened within this triple E outbreak was the aerial spraying, not spreading. And I just wanted to emphasize that here we had low-flying aircrafts that just spread pyrethrin, 5% pyrethrin throughout those affected areas. It was a really small amount, but it was weather dependent. The chemical itself has been not known to cause any health effects to humans. There were some places within Kalamazoo and other places where they did opt out, and there doesn't seem to have been any reported cases after the aerial spreading. So it seems to have, made a good difference. The good news, however, is that it's cold now. It's snowing, and so I think the mosquitoes are dying, and so I think for now, at least for this year, triple E should be over. I think MDHHS, the state, and at a national level will be looking at how to address these outbreaks for next year. Thank you.
Good afternoon, everyone. My task has sort of been to provide a wildlife management perspective, especially as it pertains to disease in the scope of this One Health idea. And a lot of the management decisions that are made with wildlife really depends on the type of disease that it is. So when we talk about something like rabies or triple E or even Lyme disease, none of those things necessarily affect deer population. Certainly we've identified deer that have died from triple E, but they haven't had any sort of population limiting impact. So certainly disease is playing a more pronounced role in how we determine how we set our wildlife management recommendations. And those things are all very important because of this One Health concept. But in terms of individually affecting or compromising wildlife populations, they don't have as much of an impact. That cannot be said for the disease that hasn't been brought up yet, which is chronic wasting disease, which I'm going to spend a majority of my time talking about today. So if you're not familiar with chronic wasting disease, we've been identifying CWD in Michigan since 2015 in our free-ranging deer herd. What it is a fatal disease of cervids, so animals in the deer family like white-tailed deer, mule deer, elk, moose. It is caused by a prion, and a prion in and of itself is not necessarily a bad thing. We all have normally functioning prions in our body, but what happens with these prions is if they become misshapen, they sort of serve as a template within your body that other prions then copy, and then they don't work as well. So what you see there is a cross-section of brain tissue of a deer that has been tested positive for CWD, and it's been stained to sort of highlight those white circles that you see there. They are not supposed to be there. Those are essentially the holes in the brain that's obviously compromise the neurological functioning of these animals that are affected with the disease. Now, it can be spread through several ways. Obviously, we know that deer are social animals. They live in social groups and they interact, they consume the same food. So it can be spread through this direct contact, through saliva, but the more insidious way that it can occur is through the indirect passage of these prions, which have been identified in urine, in feces, and also blood as well. These prions can be deposited into the environment, and there they stay. And because these prions are proteins, they don't have nucleic acids, which means they aren't living things. They're just proteins that sort of persist in the environment. So you cannot kill them like you can a virus or a bacteria. They just stay there, and they can stay there for years, if not decades. It's very closely related to scrapie and sheep. It's in the same family of diseases, and that's been infectious for several decades. So the concern now with CWD is once it gets into the environment, animals can continue to pick it up and maintain that transmission cycle indefinitely. Ultimately, within about 18 to 24 months, animals can typically show clinical symptoms, which is emaciation, drooling, sort of a lowered head or posture, and just generally not really aware of their surroundings. Now, I love showing that picture because that deer itself does not have CWD, even though it has symptoms of CWD. This animal had a brain abscess. So very few animals get to this this clinical stage of CWD, especially as the cycle is beginning and starting. It's in a recent introduction. They tend to start seeing more of these animals that are clinical after the disease has been established for 20 years, 30 years, maybe even 40 years. They start seeing more of these animals. At that point, population level impact certainly can happen, and that's what we're trying to prevent. So this is a current-ish view of CWD in Michigan. I actually just got a map updated earlier today at about 11 o'clock, so I wasn't able to incorporate it, but this is fairly similar to what the current range of CWD is in Michigan. And as you can see, throughout Montcalm County and northeastern Kent County is where we're finding most of our cases, with scattered positives found throughout about 8 other counties in the state, with 1 positive being identified in the Upper Peninsula thus far. So what happens with CWD once it becomes established, and you don't really need to see the X or Y axes on either of these things, but this is data out of Wisconsin. And what I want to focus on is the trend lines that you see. And what you see there is what we call exponential growth in prevalence of the disease. So once it becomes established, that means more and more animals start becoming positive at an increasing rate. So where these animals were being detected back in 2002 at about 1%, maybe 5%. Today, you're finding it at about 20, 30, maybe even 40% infection rate. Once that happens, it starts to compromise their survival. So this is a mortality curve that you see, again, in southern Wisconsin. And you can see that CWD positive animals, there in red, are more likely to die over the course of the year than CWD not positive or negative animals. In fact, if you don't have CWD, you have a 3 times chance of living through the year than if you do have CWD. So from a management standpoint, we're really trying to find this nexus between being biologically responsible, politically supported and socially acceptable. And we're trying to manage CWD this way. Now, to be fair, this is a conceptual diagram. This might not even, these circles might not exist overlapping whatsoever, but that's our hope, and we're going to try to root for it, and we're not there yet. So we're still working towards that. So with that, we're trying to manage our deer population. That's one of the main goals that we have, keeping somewhat lower deer densities, especially in areas where the disease might exist, but even in outer areas, because not only can that be beneficial for just deer management in general, but disease management as well. We're also trying to eliminate or mitigate the human risk associated with movement of the disease. So specifically carcass movement. So we know a lot of hunters now are traveling throughout the state, harvesting deer and moving them back to their home elsewhere. This is less about movement of the carcass and more about trying to protect against improper disposal. So what we really don't want are, infected animals being drug across the strait and thrown out on the back 40 to just sort of go back to nature. That's where it can potentially get back into the environment and infect a new source of animals. We've also limited and restricted the type of bottled deer urine that can be used in the state. Obviously, prions can be identified in the soil and in the urine, and which gets in the soil, so we're trying to mitigate that as well. And then obviously one of the ones that we've been hearing a lot about lately is baiting and feeding. So we do have a baiting and feeding prohibition in the Lower Peninsula and parts of the Upper Peninsula. The department's view on this is an additive risk in terms of congregating deer on the landscape. So this is something that we're trying to prevent. We do know that deer are social. I'm going to try to explain this in a generalized diagram using a sunny side up egg. So full disclosure, I've never given this slide before, so it'll either really resonate with you guys or it'll fail colossally and be incredibly embarrassing. Either way, you're going to be wildly entertained. So what this represents, this egg, is the home range of either a deer or a deer family group. So when you see the white of the egg, that's basically the area that a deer is occupying 95-99% of their time. The yolk is the core area. That's where they're spending most of their time. So if you're thinking about this in terms of your own life, the yolk is your home, your work, maybe a restaurant that you go to, and then everything else is, far out in a way that you go to occasionally but not often. So these eggs, these deer, exist in social groups all around the landscape, right? They're overlapping, but not as much because they're all spending time sort of uniquely separate, occasionally coming together, overlapping either in space or time occasionally, but they're largely in their own social groups. But what happens when we incorporate bait? Well, if you're in the area where you occupy a lot of your time and bait is obviously introduced, you're not going to move that much. But as these other animals discover bait over the course of their time, and that bait is repetitively replaced over and over and over again, which is a phenomenon that does not occur in the environment naturally, they alter their core range and they begin to take over the same spot and they begin to interact more. If one of those animals has a disease, the risk obviously is greatly increased amongst those social groups. So this is what we're trying to accomplish. One of the things we feel in best combating this disease is early detection and then an aggressive response. So we know that, again, deer exist on the landscape in social groups. One animal, for whatever reason, comes down with CWD and is shedding these prions into the environment. We know from a socialization standpoint, the one that they spend the most time with is also likely to come down with CWD. But if we can find these deer very quickly and remove them from the landscape, they're no longer further depositing these prions into the environment. So the prions are there. We cannot do anything about them. They are going to persist. But the animals that do not have CWD, the likelihood of that picking them up from the environment is obviously greatly reduced. So we'll go to the second scenario and what that looks like. And the same general timeline begins, but we don't find the disease, and it continues to spread throughout the deer herd. Those new positive animals subsequently deposit more and more prions into the environment. Ultimately, they go away, but now those naive animals and the prions on the landscape, there's a much more likelihood of them picking it up out of the environment. And now this epidemic is sustained over time, just through natural environmental contamination. So as I mentioned before, we don't know that if this is a true One Health situation. We know that it impacts our deer population. Seems to be a fairly robust barrier between humans or cattle or canines, but most professionals that we talk with say that there's also potentially a non-zero chance of that barrier being crossed. So again, it feels like it's in our best interest to try to limit the scale of this disease, the scope of it on the landscape, in case the worst case scenario sort of does evolve. So that's our efforts, and that's what we're trying to accomplish through CWD management, and I'll turn it over to Dr. Straka.
We do a lot of these kind of joint talks, different places, and I tell you right now, we had a conference call about this meeting, and I was like, how about I go before Chad? And it was like, no, Kelly, you can go and tie it up. And I'm like, man, because I don't have an egg slide, so I just want to point that out. He raises the bar every time.
Hoping for bacon.
What's that?
Hoping for bacon.
Bacon. Okay, yeah, bacon next time. Note to self. Can you guys hear me okay? Okay, great. So what I was tasked with a little bit is tying this together, right? So it might seem on the outset that some of these topics are a little bit disparate, a little bit different, but they really do fall under this umbrella of One Health. And in the context of what this forum was designed to do is really talk about what can people do, right? Like where are we supposed to go from here? As we know, was pointed out earlier, human population is growing. We are expanding into these areas, and we are likely to encounter native wildlife species, especially in their habitat, more and more frequently. So these issues, we know, are not going to go away anytime soon. So I was really excited to be a part of this panel today, and hopefully I can do it some justice. So Dr. Shoyanka did a phenomenal job talking about Triple E, and I'm actually really excited you did, because I think it is a very relevant and very time-sensitive aspect of One Health. And so this is one of the other diagrams out there, looking at, again, this triad. My laser's not working, but that's okay. The triad between the healthy people, healthy environments, and healthy animals. And I think in the context of Triple E, one thing that has not come up today, and I want to make sure that I do bring it up, is the importance that we can serve in the wildlife field almost as a sentinel for some of these infections on the landscape, right? So when you look at, was mentioned, we did have individual deer that tested positive for Triple E. They came through our lab at the wildlife division. Those animals came through 1 to 2 weeks before we had any human cases. So we know that what we are seeing on the landscape in animals can serve sometimes as a sentinel. Unfortunately, Triple E is not a population-limiting disease for the deer. It's not contagious between deer. We talked about the importance of that mosquito vector. But yet it can still be really important not only to understand what's happening in that deer population, but other domestic animal, livestock, human populations as well. So we talked a little bit too about the mosquito surveillance. That to me is just as important, if not more so, because that could buy us easily a month of advanced warning that, hey, we've got some vectors here. We've got some vectors that we did not expect. This is what we should be on the lookout for. So when you tie down these interfaces between what we see in animals, what we see in both domestic animals, livestock, wildlife, the environment, and people, it just becomes more and more important that we pay attention to this. So One Health, Dr. Wilkins talked about One Health as a process, as a concept that's come out over the years, and it is not a new concept. It's a very exciting thing and something that I studied fervently, borderline rabidly, you could say, because I think it's so important and I get really excited about it. But I feel like initially when some of the One Health stuff was coming out, it was hard to get people excited about because we almost fostered unintentionally this NIMBY attitude. So many of the conversations are focused on these large global challenges and what we're seeing around the world, and I never want to downplay that, but people had problems finding it relevant. And so by the NIMBY attitude, I mean the not in my backyard. These One Health issues are what we're seeing in developing countries. We're not seeing it in Michigan, right? I mean, these are global challenges. Man, I hope they figure it out, but it doesn't affect me. But as we found out today, it sure as heck does. I mean, look at Lyme, Triple E, rabies, all of this stuff exists in Michigan. We see it. And we fortunately live in a state that have a very well-developed system where our agencies that are responsible for these individual silos work really closely together. We do. And it's exciting to have that kind of partnership, certainly at a state level, and it's not like that across the country. I would be remiss if I did not bring up one of the diseases that I do work with quite a lot as my role with the wildlife health section through the Department of Natural Resources. So bovine tuberculosis, I promise you, I'm not going to hammer too many diseases. I realize it can get a little depressing, but it's an important one. And this is a One Health issue that's really close to home, right? There are a lot of folks here in Michigan that are dealing with this. Our cattle farmers, our hunters, our general, especially our legislators and decision makers. This is a really important issue to talk about. And so I just wanted to bring it up that we do have TB. We have this disease. It's caused by a bacterium, and it is endemic. And by that, I mean it is circulating, it is established in our wildlife populations, in our free-ranging deer population in the northeastern northern lower peninsula. So handy built-in anatomical map. We're talking right up here, okay? So we have what we consider, the DNR considers, a 5-county area where this disease, we know, circulates throughout the deer population. It is zoonotic. So this is a zoonotic disease that we know about. This is a known risk. We have had a few cases of bovine TB in human beings. There have been at least 4 cases that have been reported. You can see in the lower right-hand picture on that slide, that was a cutaneous exposure where a deer hunter was field dressing. Thank you very much for the time warning. That was convenient. I'd be up here all day otherwise. I don't even know you, but that was convenient. Cutaneous exposure. So they had a laceration. They cut themselves field dressing, and later were found to be positive with TB. This is where I have so much kudos for our human health professionals. Somebody very astute said, you're a deer hunter in this area of Michigan. You've got a non-healing wound on your hand that you got processing a deer. You might want to get that checked out. Let's culture that. Let's see what we're dealing with. Man, if they hadn't done that, it wouldn't be such a happy ending. Fortunately, it is easily treated with antibiotics if it's caught early. The middle picture I put in here mainly because you guys are done with lunch, so there's no excuse for you to not be able to stand this, but that is actually what happens inside the deer. So bovine tuberculosis is primarily a respiratory pathogen. So when you pull out a deer lung, I know not everybody in this room probably looks at them daily like I do. I'm sorry you don't get the fun that I do. But that is certainly what we see in a bad case of TB in deer. So to step back a little bit from TB and talk more about this One Health, Dr. Wilkins talked about zoonotic diseases and what those are and the importance of the fact that those are diseases that can cross the species barrier, right? They can go both ways, and I cannot reiterate that enough. The total number of zoonotic agents out there is unknown. There was a study, it's a little bit older now, I'm aging myself by the minute. But in 2001, there was a study that looked at, of the over 1,400 known human pathogens, 62% were of zoonotic origin. And if you recall a statistic that was earlier, that it was 75% of the emerging agents are thought to have an animal-based origin. So what we're seeing is that we know a lot of our known human pathogens have a tie to animal health. And of the more recent ones, the ones that we consider are emerging, that proportion is growing. So this is definitely nothing that's going away anytime soon. So I run down the road of, man, I went to this lunch talk and it was fantastically depressing. And, and honestly, I'm scared to go outside because we got ticks, we got mosquitoes, we got deer running around. Like I'm just going to stay inside and watch Netflix and chill. And that sounds really good right now. That's more my habitat. But okay, so I'm here now. And so I'm here to tell you what can you do, right? Number 1, the wildlife vet says, listen to the squirrels, okay? Let's not have Lyme anxiety or all these other panic attacks that apparently is a thing that I didn't even know about, so thanks for sharing that. Don't panic, all right? It is still safe to go outdoors. You can write that down and take that home with you. It is still safe to go outdoors. Take a deep breath, but use common sense. And I'm so grateful for you today, too, for talking about some of these common sense precautions that we can take to protect ourselves. And we already talked quite a bit about using the DEET and using pyrethrins on your clothes to prevent ticks. So that's definitely common sense. I'm going to take it one step further. You're welcome. These guys, okay? As more humans are expanding our natural habitat into wild animal natural habitat, we start seeing a lot more of what are affectionately known as, trash pandas. 2 minutes. I can do this in 2 minutes. That's a challenge. These are cute. These are like genetically engineered by nature to be the cutest living things in the world. There's not a human being who's not like, oh, I want to cuddle that, until you open them up. And you're welcome for this photo too. This is the inside of a gastrointestinal tract. Didn't think you'd see that at this talk, right? Those are my overly large blue fingers that is literally everting the GI tract, the intestines of a raccoon. And what you might not be able to appreciate are all the little worms poking out of it. That's a parasite that's known as Balis ascaris procyon, the raccoon roundworm. It is not uncommon in raccoons. It is zoonotic. These are things that we don't really want to be exposed to. So suddenly, that adorable picture on the left is not so adorable. So people are like, oh my gosh, they're terrible. We have to get rid of raccoons. No, we just don't have to do this. Please, please take home message. Do not feed, pet, cuddle, kiss, or allow wildlife into your home. The fact that I have to say, do not kiss wildlife, is a sheer reflection of the fact that when I started Googling human-wildlife interactions, the number of pictures of people that are kissing wildlife was astounding. Please don't do that. Please. This is a plea. Feed your pets indoors. This is common sense, a little bit less tongue-in-cheek, especially cats. I don't have anything against cats, but what I'm saying is people are notorious if they have indoor-outdoor cats, which is a whole nother topic. I'm just gonna leave this bowl of kitty chow on my porch. Guess who doesn't eat it? Your cat, because the trash pandas get to it, and the possums get to it, and all of a sudden these animals are becoming very comfortable with our houses, okay? So not a good idea. Feed your pets indoors. Secure your trash. You know, I see that a lot. Well, these raccoons keep it in my trash. Well, maybe put a lid on your trash. Maybe put a brick on top of the lid. These raccoons get pretty big, especially if they're fed by your neighbor like that, so maybe you need something bigger than a brick. Either way, these are common sense things you can do. So I will wrap up. I think I'm already getting like the hook. Common sense, again, leave wildlife wild. So we are encroaching on their habitat. Let's be honest. We have to share this space, okay? So please don't bring them into your home. We have a resource. There are several of the One Health resources that were provided today are amazing. That Emerging Diseases website, all the TB stuff you want is on there too. Tons of information for you. mi.gov/wildlife has a nuisance animal handbook specifically designed for landowners. Wow, we all have them. Well done. Landowners. A nuisance animal handbook so that you can actually see some of these common sense recommendations and resources for you. Finally, I'm wrapping it up. Dr. Wilkins had this image before, and I loved it, so I wanted to share it again because I shamelessly plagiarized, and I also thought it was a great way to close how we started with the importance that we know these diseases can go both ways. Okay, so keep that in mind, too. You might think those wildlife are so cute and you want to cuddle them. You don't want to give them something that they've never been exposed to either, so please keep that in mind. And that's pretty much it. Do you see how I'm like closing with the scene of turkey butts walking away? So this is like closure, right? But either way, certainly we are going to have these problems continuing as we encroach on these natural areas. So that's just what I wanted to tie up with today. Sure.
Fulfilled, lots of information, right? So do we all just want to kind of go like this and check? Just check for the ticks? I think we're all good. We will post these presentations in the website. Noted a couple of times, there were a few of them mentioned. We'll post those on our website. On our website, the Institute for Public Policy and Social Research website, so that you can go to that. Tons of information, really, really helpful. So, who has the first question? I have the first question while you're thinking about yours. Just raise your hand. But Dr. Wilkins, you had said that in Michigan you were talking about what has rabies, and you threw up a picture of the bat and the skunk. And are there other animals that carry rabies in other states that they're more prominent? The rabies is more prominent among, I should say. There you go.
In Michigan, rabies is basically the reservoir animals are the bat population and skunks. We get an occasional fox strain rabies that comes through. South of us, raccoons are a big vector for rabies, and we've been working closely with state and federal partners on the wildlife side to create some barriers in blocking aerial vaccines to try to keep the rabies from spreading from the southern raccoon populations, which is some of the northern ones. Also, coyotes can be a big factor in the Southwest, especially for carrying rabies, as well as skunks in the Pacific Northwest. So there are different strains of rabies, but those are the main ones. Bats everywhere.
In domestic animals.
Yeah, that's the wildlife. And domestic animals, about any warm-blooded mammal can carry rabies. Some of them are better at transmitting it than others, but there's a protocol you go through if you have suspicion about a positive animal. If you see a raccoon that's acting in the middle of the day and it's wobbling around in your front yard, we were trading stories, you're just not acting right, you can call your animal control, call your local health department, and kind of figure out if that's an animal that needs to be tested. We don't have raccoon rabies in Michigan right now, but we are looking for it. So, they're definitely going to kind of keep an eye out for that. But it's the bats are the biggest issue right now. We do have a lot of bats in attics. Don't leave them there. Have to take care of them properly.
Based on a priori considerations, do we expect another spike next summer with triple E? Maybe Dr. Schwenka.
Yeah, thank you. So that's a good question, and nobody really knows. Like I said, it's hard to predict these outbreaks. It really depends on what, the environment tells us over time, what temperatures look like, how much rain we get, could be factors. There's nothing, so far we haven't been able to figure out what contributed this particular outbreak, but there's a lot of interest into looking into it in terms of seeing, looking at the different strains of the virus themselves, whole genome sequencing and things like that to figure out if there was a way that this was kind of maybe transported from one place to another. Did birds bring them, from one place to another, or why we had such a amplification, so to speak, of the virus this year, so.
And how has Kentucky managed to dodge the bullet? I noticed there were no cases in Kentucky. Historically, it just seems odd because it's kind of a center for I think, for horses in the US. It just seems
Bats.
like an oddity there. Not a
I'm
single
not so
case.
sure.
Maybe not as much rain.
Possibly.
Mm-hmm. Okay.
Yes, in Michigan, we've created a number of urban environments that seem to be really quite neat for deer and other animals. Are you aware of any studies that have chronicled maintenance activities to hold your populations at a reasonable level? I happen to live in one that has runaway deer population, so I'd like to see what's being done.
Yeah, so, yeah, there's been, deer are probably one of the most studied wildlife species that we have on the planet, especially as we talk about white-tailed deer. So the challenge with white-tailed deer numbers is that it's very easy to grow the deer herd. It's very difficult to reduce them and then keep them at a low level. And that's based on their general reproductive biology. So the cute little fawn that you saw in May, June, that was born, down here, there's probably anywhere between a 15 to 25% chance that if that fawn was a female, she will be bred later this year and then have a fawn next year. So they can actually start their reproductive cycle very early in their life, and alternatively, there's no reproductive senescence in female deer. So if that doe, that female deer, can live to be 10 years old, 12 years old, 14 years old, she will continue to have fawns, typically 2 per year. Occasionally it might go down to 1, occasionally it might be 3, but on average they have 2 deer per year. So their population has a fairly incredible ability to explode, especially in the absence of mortality, which they're fairly long-lived and do a pretty good job of living throughout the year with the exception of during the hunting season. So in areas where there's a lot of hunting, population numbers can be managed fairly well. That's becoming more and more difficult as we continue to see fewer and fewer hunters participating. It also becomes a lot more difficult and challenging as land ownership begins to parcelize more, preventing access. And that's where the challenge with urban deer management comes in. Because you're looking at a lot of 1/8 to quarter acre lots that collectively provide very good deer habitat, but individually make it very difficult to access those deer from a hunting standpoint. So there has been hunting that's been tried, there's been sharpshooting that's been tried. Those can work in terms of reducing the deer population and keeping it and limiting conflicts. There's been contraception and sterilization that's been explored, more of a long-term, non-lethal approach. Those tend to not have quite as much success because, again, you need to have access to about generally 90 to 95% of your female deer to start making an impact over time and curbing reproductive output. So it's an incredibly challenging proposition to manage deer in these urban settings. And we try to work individually with each community to try to address their goals and what they're trying to accomplish. Usually it's conflict driven, and then try to come up with the best solution that is beneficial for that community.
I think this is another question for Chad, CWD question. So as you know, there's some skeptics out there that don't think CWD is such a big deal. And I've heard the question asked, so if it's such a big deal, why in these states that have had it present for decades, 30, 40, or 50 years, why hasn't it decimated their deer herd completely if it's such a problem? I'm not believing that myself, asking for a friend. I'm just curious what your answer is.
Yeah, I think when we talk about chronic wasting disease, scale is important and context is important. So CWD moves very slowly, and it takes a long time, both within the population and then geographically spreading. So it takes a long time to build up within your deer population, and it takes a long time to spread out from wherever your centralized focal area is where it began. I would say that to those critics, there are several peer-reviewed publications out there that have demonstrated CWD is having an impact on populations. But when we talk about it in terms of a statewide scale, obviously the disease has not advanced to the level across an entire state like Wyoming or Colorado where it's having those impacts. So those parts of those states are still able to hold their deer hunting and maintain their regulations without any sort of regard to having CWD have an impact. Certainly they're conscientious of it. But in some of those other places, the agency has actually curtailed antlerless harvest. Again, the reproductive output that's trying to sustain the population over time because they've demonstrated that high levels of CWD and antlerless harvest, basically promoting the future fawns in the population are not compatible. They are not sustainable. So because they can't manage CWD because it's become so advanced, they have to manage it through the hunting aspect, and that means curtailing opportunity, curtailing what you can shoot. So that's the fear that those places over time will become more commonplace throughout states that are dealing with this. But the skeptics are right. You can go into Wyoming, into Colorado, places that have been dealing with CWD for 30 or 40 years and have fantastic hunting opportunities, but there are locations within those states that are struggling with this disease in terms of their viability and the sustainability of their deer herd. Kelly, you have anything to add?
No, that was good.
Know that you had talked about the carcasses and speaking with deer hunters about not just throwing the carcass out into, under the tree or out on the farm or whatever the case may be. Are you working with processors in teaching them about how to dispose of carcasses in a healthy way, or how do you dispose of a carcass in a healthy way?
Yes, to answer your question,
It's a tough one.
Well, we
Common one.
we try to work with as many people that are willing to work with us on this. So we We absolutely work with processors, we work with taxidermists, not only from a surveillance standpoint, but talk about, you know, how these animals can best be disposed of. You know, we've had conversations with various landfills and talk about, you know, what the risk might be. But ultimately, it comes back to that conversation with the individual hunter, because they decide where that animal goes in many instances. We know that about 50% of our deer harvested in Michigan go to a processor and 50% are self-processed. So we try to cover all our communication standpoint, and as was previously mentioned, there are some individuals that take this disease very seriously and want to do what's best for the long-term betterment of our resource, and others that view it as an inconvenience and are less likely to work with us on it. So challenges.
Absolutely.
Yeah, thank you. I really appreciate the talk. What are the predators for a lot of these animals? Around our house, we have mice, snakes, rabbits, possums, skunks, turkey, deer. I don't see any owls, for example. I think owls eat some of these critters, but I don't see any owls, hawks, or whatever. Just kind of curious if you comment on where are the predators for a lot of these animals that can potentially carry these diseases. And I appreciate some comments that were made. My wife and I have put a bird feeder out by our house, and we said, oh, it'd be cute to see the birds in the morning feeding. Well, the birds scattered seed on the ground. Before long, we had mice in the house, and figured that, you know, inadvertently caused mice into our house. We, after a while, found a spot where they were coming in and sealed it, and no more mice. And we've had bats in our house, and it was $1,500 to have the bats taken, gotten rid of the bats. So it's something you have to stay on top of. But I'm just curious about where are the predators with some of these small animals? Thanks.
Predators for the small animals.
I'll take a brief stab at it, and if anybody else wants to chime in and either add or correct, that'd be fine. So I think one of the important things to think about is, gosh, I go back to like my elementary school like food pyramid type thing. So as you get to the top of the pyramid, you know, those animals that are carnivores that are you know, holding these other populations, there are fewer of them out there on the landscape. So we have predators on our landscape. We have coyotes, we have several different species of fox, we have owls, we have hawks. But the number, as you go down that trophic level, the number of animals is far greater. So it's a long way of me saying there are far more white-footed mice out on the landscape than there are foxes, than there are great horned owls, and that's by design. So if something were to happen from a habitat standpoint that compromises the growth of those predators or affects that top of that pyramid, there's less in check to hold those lower level species on the trophic level in check. So as we start to see any sort of habitat or urbanization that might actually promote the growth of, you know, Peromyscus, which is the white-footed mice populations, and curtail the growth, or at least the activity of some of the canines like foxes or coyotes, or they remove some of the trees that maybe the owls or hawks are nesting in, there's less resources and management, I guess, over those trophic levels to I guess, control those burgeoning you know, populations that are at those lower levels. I'm doing a terrible job.
No, you did a great job. You did a great job.
So somebody else that has fancy letters behind it.
I'll do probably, yeah, the alphabet soup behind the name,
Yeah,
but you
save
only
me.
confers any level of expertise. But what I will say to that, and I don't know, you know, I don't know where you live, but one thing to keep in mind with some of this too, and Chad was right, I think you did a surprisingly good job. But, you know, especially as we get closer and closer to human habitation, most people, especially if you're in a suburban environment, you know, you have neighbors, you have dogs, you have domestic cats, you have kids, you have a lot of activity that is unappealing to some of our predator species. But if you were to go out and drive not far from Lansing, I mean 10 miles outside, you know, and we have that agricultural interface, and you look up on those power lines, I guarantee you see a lot of hawks, you know, but they're far away from where we have more people concentrating. So I think you're right. I think the predators, generally speaking, the numbers are substantially lower. That's by design. You know, a whole lot of prey, a whole lot of food base, and fewer numbers as you go up. But also owls, which most species of owls hunt primarily at night. If you're in an environment where people have house lights on and street lights, the owls can't even see their prey that well, let alone do they want to be flying around where there's lights at night. And so they're still here, but you just might not, they might be in areas like larger state game areas or larger, more, something that serves more of like a preserve, right, where you don't have a lot of human action. So I think that might be part of it too. Certainly when you talk about predators on deer in the Lower Peninsula, I'll tell you right now, there aren't a lot of native predators on deer in the Lower Peninsula. So the UP obviously has some pockets of wolf populations that can impact that, but that would be just my thought. Right.
Well, one thing I wanted to skip to is the overall concept of One Health and how everything relates, because here in this context, we didn't really talk about water quality and how that impacts one's health, you know, the environment, animal, and human health. We didn't really talk about food safety and security other than how it might relate to chronic wasting disease. So I can see, and the reason I wanted to point that out is because as presented, the One Health framework, or the way of thinking through how we're all related, how all of these sectors are related, it seems like it would be really key to diagnoses. Like when you walk into a physician's office or you walk into a vet's office, that it would be important to have some sort of background. Do you have pets at home? Do you live in an urban or rural area? And that's where I really appreciate Dr. Mallowin and your program that you're developing, and that you're reaching out to professionals to say, you know, this One Health concept is really a problem-solving framework if you think about it. So I think that's a framework that we could use at home and in our neighborhoods too. You know, where is this coming from? What are the trouble zones that we might be able to address? And from our panelists today, we heard of quite a few things that we could do to manage some of the diseases and some of the problems that we're having right now. Like you said, it's getting a little blustery. Dr. Shoyinka, you said, you know, it's getting a little cold, so some of our concerns about 3E can be subdued a bit. But you also said that tends to be this 10-year cycle for this, and so maybe we got over a hump. We'll see, right?
Yeah, well, maybe not. I'm
Yeah.
not so optimistic, actually. Like I said, things are changing a lot with regards to the way what our climate looks like, with the way where human activity is making a big difference in where we're moving to, and so those cycles may become shorter. It's my thought.
It's important to benchmark, right? There are checks and balances. Well, I promised the panelists last word today, as we typically do in these forums. So I want to give them that opportunity to give you their call to action or their key points. But I also want to point out that, you know, just like this problem that we presented, you know, these forums take a good deal of teamwork. And so I just really want to thank the panelists from the different sectors for coming together and presenting this great information on One Health, let's just say. Let's give it the title of One Health. So Dr. Wilkins, as a veterinarian, as a public health official, and I could go down the line, the number of roles that you've played in this arena, and Dr. Mallowin, the way you two have come together. I've been hanging out with these guys, so those worms didn't bother me a bit. And Dr. Shoyinka, thank you so much, because you're the face of public health, right, in this region. So thank you for your efforts. And Chad, you know, you've really handled all of these problems well for us. Thank you. Thank you so much, because I really, there's a curiosity, but there's also just a huge concern for what's happening in wildlife today in Michigan, but it's really everywhere. Dr. Straka, thank you so much for being here and taking time out of the lab, because I know that's a busy place that you're in. And I think together you've really come together to present a well-rounded set of facts and things for us to think about. I also want to thank my team, which is Leah Owens is in the back. I have a whole set of students who helped put all of this together. And for those of you who shared the email or the PR kinds of things that we send out to fill this room, it's much appreciated. And the reason I'm kind of bringing all of this together is, or being sure to thank my team, everything from the videographer, the photographer, thank you. You guys are always with us. This is our last forum for the year. We're going to take a little break, let the legislative session end, tie up, and everyone can have a nice Thanksgiving and a nice Christmas holiday, and we'll come back together in November. So, but for now, I'd like to go back and check in with our panelists to tie up today's presentations.
I just had a couple thoughts I wanted to share, and one of them is that I think as specialists, we kind of get settled in our little area of expertise, and it's actually a challenge to, reach outside of that. I think we see that on the academic level. I think also if you take the time to do that, you end up with some pretty incredible collaborations. I think at the state agency level, we do a pretty good job reaching across. Sometimes it's hit or miss because different agencies have different missions and different regulations. There can be some territorialism, and there can also be gaps in who actually does deal with the importation of wild gophers from Africa. There's things like that, that don't fit anywhere, and somebody needs to own that issue. But I guess I would encourage you with your constituents, whatever they may be, because it's quite a varied background, is to, take the time to get opinions from other people. Whether it's your neighbor that's a hunter and you're a dairy farmer, or, you've got a neighbor who wants to poison the coyotes because they're coming in your backyard and threatening this or that. Talk to each other, and get that conflicting opinion, and then sit down and think about it, because there's always going to be two sides to every issue. So, at a very local level, you can be practicing One Health and say, well, if we do, want to treat something here, we're putting chemicals in the environment. What is that going to do? I like to think about it in the framework of, those Venn diagrams, and try to say, okay, so what are some other angles? What should I be considering? Who should I be calling? What are the questions I should be asking? So I guess that's kind of a lot of questions more than a statement, but just encouraging that broader thinking.
I guess I'd like to say that although there's a lot of new and emerging infections out there, there's a lot that can be done. And so I think our job as professionals is to try to reduce that anxiety. Yes, there's new things. Yes, we're also looking for things more frequently and probably better than we ever have before. But there's a lot of things we can do to protect ourselves both personally and at a community and at a state and national level. And just to kind of make sure that that message gets out to the people who need to know it. And working with professionals, we can do that. And I think that's why the One Health approach is so important. Some things may be medical, some things may be wildlife management, some things may be environmental. So it takes all of us working together to try to address these issues.
So my one thought in looking at things like Triple E and the multiples, even CWD, is that we all have different opinions about what is causing these things, what precipitates them, whose fault it is, or what action did one person versus the other take. And one thing I just want to leave with us here is that regardless of what our actions, what our beliefs are, what our opinions are, we all share a common risk of whatever those diseases are. So for triple E, it's super rare. But for the one person who does get it, it's 100%. For any other thing, likewise. And so as we think about how we live our lives and do things as individuals, we also need to strongly consider, as professionals and as individuals within our community, what that shared risk is, because it could fall in anyone's lap at any point in time. My second thought is that I just wanted to let everyone know that public health is always for you, so please let your constituents know that the local health department is always open. Our doors are always open to make sure that our communities are happy, are safe, and are healthy.
Thank you.
Wow, these are really good. Wow. I won't say much. I would say that with a lot of these, I think, foundationally, we're focused on both communication and education. And certainly, we're always exploring as agencies and I guess professionals or specialists, exploring different ways to communicate these risks. So we're always trying to look for new ways to get these messages out. And a lot of that is done, through keeping up with, the recent research, the recent findings on a lot of these topics, and communicating those outwards under new, different type of media, because the way people communicate and bring in information is always changing, it seems. But I would certainly encourage everyone else that wants to get informed about these things to read up about it, and not only that, but take in a multitude of different opinions and then form your own, rather than just reading one perspective on it and then having that form as your basis for your decision and how things are moved. So I always think that education and trying to understand both sides of a lot of these issues is really important. And then the individual can make their own decision on how they want to proceed with, risk mitigation and things like that. So that Kelly can close.
Okay. There you go. Yeah, these are really good. God, I really need to go first from now on. So what I was thinking about actually, as I was sitting here, is I have a 5-year-old son. And I followed him out to the barn one night last week, and he was going into our wood shop, and he picked up a chainsaw. And I was like, buddy, what are you doing? And he's like, well, I'm gonna go cut down some trees for a new pasture. And I said, oh, you are? Okay. And he goes, yeah. And I go, buddy, I'm a little worried about you using a chainsaw. You're 5. And he goes, Mom, I'm an expert. And I was like, oh, you are? He goes, yeah, I saw it on YouTube. So I think which scares me. So instantly all phones are now removed from the house. But no, so I think the one thing I want to get across is we live in an age where information is at our fingertips at any moment of any day, right? And we all are suffering, I think, from a little bit of information overload and emotional overload and messaging overload and overload and overload of overload. But I think one of the important things to keep in mind is, especially when you come to these really important topics that are related to health and One Health, be careful where you get your information from. So the websites, the references that were given today are unbiased, objective, scientifically sound resources. But I promise you, if you Google a lot of things, you will find things that are not unbiased or objective or scientifically sound, and quite honestly, very detrimental. Even when it comes to things like what you can do to remove a tick from your skin. Yeah, don't light it on fire. Okay, if the word kerosene is on the website, it's probably not a good idea. So that's the message I want to get across, I guess, from my standpoint, is when it comes to One Health, just understand the importance of it and be aware of where your messaging is coming from.
That's great. That's wonderful. Well, thank you again. From the Institute for Public Policy and Social Research at Michigan State, we wish you a nice break. Hopefully a nice holiday is in your near future. And if I could get a round of applause for the panelists, we'll call it a day. Thank you.
Good deal.